And I've got some of my friends here today with me. So we've got Oyinkan and Gloria, which are also second year pharmacy students, and they're gonna share their experience on what their journey has been like so far. So I'm gonna start off and just speak to you guys a bit more about the MPharm degree and what to expect. Okay, so let's just talk about a little bit, about the course in general. So MPharm stands for Masters of Pharmacy. So it's a 4-year course, which at the end of it, after you graduate, you do a pre-registration year. Now they've actually changed it for, I believe, the year group below us. So it's now called a foundation year. So in this year, you're training to become a pharmacist. So after the 4-year course, you're not actually, even after graduation, you're not actually a qualified pharmacist. You need to undergo a year of training. So during this time, you can choose where exactly you want to work. So which sector of pharmacy you want to work. So like I said previously, pharmacy is quite broad. So you can either choose to work in somewhere like a hospital pharmacy, a GP pharmacy, something like industrial pharmacy. There's quite a lot of things that you can do. And once you've made your decision on where exactly it is that you want to work, you're kind of trained there for a year. And then at the end of the year, you do like an exam. Once you've done the exam, then you become a qualified pharmacist. So that's kind of what the MPharm course consists of. There's different modules. They kind of vary depending on the university. We're gonna kind of delve into that a bit further on during the slides. It also consists of placements. So during the MPharm course, you have the opportunity to, have quite a few placements, which is exciting because you kind of get a feel of exactly what it is that you want to do. You get a feel of, hospital, community, just a bit of everything to kind of give you that ground decision of what exactly it is that you want to do. And then you have a portfolio. So over the 4 years, which I'm going to explain a bit further, you're building up your portfolio. And this is really important because it's a professional portfolio, which kind of shows that you are meeting the standards of becoming a pharmacist. We're going to discuss that a bit further on in the slides. So the entry requirements to actually get onto an MPharm course is usually 5 GCSEs with a grade 4 or above. The usual typical A-level offer would be ABB2 and AAB, usually in chemistry, biology, or maths. A lot of universities also accept a BTEC level 3 applied science, which is something that I did personally. So I didn't actually do A-levels. A lot of universities actually accept that as well as a entry requirement for pharmacy. So here are a few modules. So this is tailored to my university. So this is tailored to University of Lincoln. But overall, other universities do tend to do this, but probably call it something different. So at my university, we don't actually call it modules. Everything is kind of integrated. So we have chemistry, we have biology, we have pharmacology. You're probably wondering what pharmacology is. So pharmacology kind of relates to, studying the action of a drug. So you're thinking more so about how the drug works in your body. This kind of is a bit different to pharmacy because pharmacy is more so, how you can kind of like dispense drugs to patients. And it's a bit more like a patient-centered care approach. And then you have pharmaceutics. So pharmaceutics kind of refers to manufacturing drugs. So you would most likely be in the lab for this. You kind of want to make sure that, the medication is safe to be consumed by the public. So you're focusing on, on its design and on its form as well. And then you have pharmacogenomics, which is kind of the study of how genes affects a person's response to drugs. So here you're looking a lot about genetics. That's kind of what this module is about. And then you have pharmacy practice. So this refers to, the law of pharmacy. So you have a lot of regulations and different laws that you need to follow in order to dispense safely. So for example, here we kind of learn how to read prescriptions legally, making sure that we know exactly what needs to be included on a prescription. We also kind of focus on, how to communicate with patients. So we're really trained to know how to have consultations, so patient consultations, and just knowing how to communicate with them a bit more as well. I think I also mentioned on that one that they do vary depending on the university, so this is not a set in stone. Assignments and exams. So we have quite a bit of assignments and quite a bit of exams, which I know Oyinkan and Gloria will kind of go into a bit further. So in terms of assignments, we have lab reports. So in terms of having labs, we don't have labs quite frequently, not in first year and second year anyways. We've had it quite here and there. But when we tend to do them, we have a report afterwards. And this usually consists of, answering questions based on the experiment that we did. This usually includes calculations and analyzing the results that we've, gained from the experiments. We also have posters, which we've been doing quite frequently after something that we call interprofessional education. So this is basically when we have a meeting with other healthcare professionals in our university. So this varies from medicine students, biomedical students, nurses as well. We kind of come together to come to work together. And once we've done that, we kind of do an assignment. So this varies from being a poster or an essay. So I think the one that we had recently was a poster. So we were kind of required to make a poster about the different healthcare professionals that there are. And we had to mention exactly what each one of them do, which is quite interesting. You can kind of get creative in assignments such as that. We also have, I think I just mentioned that we have essays. We have something called care plans as well. So care plans are basically used in a hospital setting to record. So it's basically a document that records the health needs of a patient. Usually when they come into the hospital, the healthcare professionals at the hospital jot down their healthcare needs, and they also outline exactly how they can be supported. So when we have a care plan assignment, this is kind of used for our practice. So we're usually given a scenario of a patient, and then we have to fill out their care plan. So we have to write down exactly, what drugs they're on. And we use something called the BNF, which is a formulary of drugs, to kind of help us to know, what exactly does this patient need and how can we support them. It's actually quite interesting. Then we have exams. So with the modules that I showed you earlier, we don't have this often, but sometimes we can have exams based on these modules, so module exams. So for example, we can have an odd chemistry exam or a biology exam, but depending on the university, they could strictly have those. We also have end of semester exams as well. So at the end of a semester, we have a large exam, which kind of consists of everything that you've done during that semester. They tend to be quite intense, like it's something that you definitely have to be organized, consistently revising for. But yeah, they really do test your knowledge during that time. We also have a calculations exam. So during the MPharm degree, you are required to do quite a lot of maths. So it's not your regular maths, it's more so pharmaceutical calculations. So I'm kind of referring to dosages. You'll be looking a lot at dosages, molecular mass, stuff like that. And in our first year and our second year, we were kind of required to have a maths exam, and for our unit in particular, we had to get 10 out of 10. So we had to get 100% out of that maths exam, which can be quite daunting, especially, coming out of sixth form and kind of wondering, how am I going to get 10 out of 10 out of my first maths exam? But you should be given a lot of support during that time anyway. So it is definitely possible to do. Then we have placements. So with placements, we basically have hospital pharmacy, we have community pharmacy, which is also known as like your local pharmacy. We also have a GP placement. So with these, even recently, for this year, we basically had a day in each sector, which was really interesting for us. So basically, for example, the hospital pharmacy, we were given a pre-reg pharmacist, or just someone that can another pharmacist basically that will kind of take us around the hospital, showing us different aspects of the hospital. We even had the chance to, speak to patients as well, which was really interesting. It kind of builds up your confidence and it allows you to kind of apply the knowledge that you've gained at university. We also had a community placement as well, whereby you work in your local pharmacy, you're receiving prescriptions, you're serving customers at the till. It's kind of a variation of things, and a lot of community pharmacies tend to be busy as well, so you can kind of get your hands in different things, which is really interesting. You also have GP placement, and that is also actually quite interesting as well, because there's doctors there, there can also be like stuff like physiotherapists there's different types of people, and you can kind of gauge exactly what everyone else does and how they work together as a team. So that's really, really interesting. So placements do count to our end of year grade. So we tend to have like pre-work for our placements, which is usually like a workbook where you kind of have to complete certain tasks before going on placement. For example, one that we had was actually to record a video of ourselves counseling a patient on how to take an inhaler. That was really interesting because it's like, even though you're just recording yourself, you kind of really have to think about the steps in which you need to kind of go through to have a full-on consultation with a patient. You kind of need to have in your mind, okay, this is how I need to communicate with them. You really need to break down the information as well. So oh, I think someone's joining. Yeah, so it's really interesting in that way. And then we also have tests as well that we have to kind of prepare us before we go on to placement as well. So these are usually questions that surround the patient, or also topics that we've already studied. For example, asthma is something that we've been studying recently, and so the test would kind of, it will kind of go around that. Okay. My screen is a bit frozen. Oh. Can you guys still see my screen? Someone let me know. You can still see my screen.
Yeah, we can see it.
Okay, cool. All right. So we also have something called a professional portfolio. So this is quite interesting. So if you, so what I said earlier on was regarding the portfolio which is a part of the MPharm degree. So at our university in particular, we have something called LinkApp. And LinkApp is basically a professional portfolio which includes the evidence of you demonstrating GPHC standards over the 4-year degree. So you're probably wondering, what is a GPHC standard? So GPHC basically stands for the General Pharmaceutical Council. So this is basically the body that is responsible for all roles in the pharmacy profession. So they kind of regulate, basically just pharmacists, pharmacy technicians, everybody that's under the pharmacy profession. They are the council that regulate that. And so they have 9 standards that, as pharmacists, you're meant to follow. So over the 4 years, you're building up a portfolio which demonstrates that you can follow these standards. So for us in particular, we basically have to do an entry for each standard each semester, and we have to demonstrate how we've done it. So whether that's, an activity that we've done or an event that we've, turned up to, how does it relate back to one of these standards? And that's kind of how you're building up your portfolio over the 4 years. So you have one standard for each semester. So each university does do this differently. And not every university calls it LinkApp. This just literally stands for Lincoln Professional Portfolio. But yeah, every university does have a professional portfolio that as a pharmacy student, you're required to do across the 4 years of your degree. And then lastly, we have OSCEs. So this is a really interesting one. It's definitely something that you probably would enjoy. So basically it's an assessment which involves the role play it basically involves the use of role play with a patient. So it's basically a fake patient. So probably a member of staff or someone that they brought in externally. So they basically assess your communication and your practical skills. It's usually a face-to-face assessment, and you have it's like a circuit. So you have about 6 different stations where you'll spend about 10 to 15 minutes with your patient. So for example, if I could think on the top of my head, there's a station that's on like it's called brief intervention. So during this time, you have about 10 to 15 minutes to talk to a patient about a condition, for example. So let's say something like, I don't know, healthy eating or diabetes or something like that. You have about 10 to 15 minutes to speak to your patient and give them the key information regarding that topic. It is quite fast paced. It can be quite nerve-wracking, but just making sure that you've prepared beforehand is definitely something that is really essential and can be built up through other avenues such as placement. And even if you do end up working alongside your degree, it will really come in handy because, you know, you'll be able to apply that practical knowledge of what you've learned. So that's the end of my PowerPoint. My friends, Oyinkan and Gloria, they're also pharmacy students, and they're going to share a bit more about their experience in pharmacy from first year till now. So yeah, Oyinkan, I believe, is the first one to share her PowerPoint. So whenever you're ready, you can do so. If you do have any questions, you can always pop it in the chat as well. And yeah, Oyinkan, whenever you're ready.
Hello, my name is Oyinka. Thanks, Stella. And I'm a second-year pharmacy student, and I'm going to share my journey into pharmacy with you. So let's get started. I can move this. Okay, so start of the journey. My journey begins in Ireland. I'm actually an international student, and I did the Irish Leaving Certificate. So I basically studied 7 subjects and sat exams for each. This is all entailed in the Leaving Cert. So I sat an exam for Irish, English, maths, Spanish, biology, chemistry, and business. I began looking into studying pharmacy in the United Kingdom due to me wanting to broaden my options and not limiting myself to just Ireland, as only 3 universities in Ireland offer pharmacy. So I knew the competition in Ireland would be very high, which is obviously why I applied to study in the UK. The possibility of moving to the UK by myself at a young age to study pharmacy was a mental battle I had to conquer from very early in the journey. So the process of applying, to the UCAS was the exact same process for me as an Irish student. The only difference involved was having to contact each university to figure out the equivalent of the A-level grade to the Irish Leaving Certificate, as both countries have a different grading systems. Most universities were only interested in my maths, biology, and chemistry grades, as these subjects that I studied were the most relevant to pharmacy. So why I chose to study pharmacy. My initial interest in pharmacy began as a young child when I had to take anti-malaria medication on a family trip to Nigeria. This medication prompted my interest in drugs and how they work in the body. My interest then began to develop in secondary school, where I studied general science in junior cycle. And then in senior cycle, I focused more on chemistry and biology. So I really got to get a really good insight into chemistry and biology and really see how the pharmaceuticals work. So this really prompted my interest, as I really do like chemistry and biology. I also enjoy socializing and discussing with people. I then knew that pharmacy would allow me to have a lot of patient interactions. As a pharmacist, you will be having a lot of face-to-face interactions with people, doing stuff like counseling sessions. You do a lot of counseling on inhalers in a pharmacy. So I knew just having general discussions and counseling and talking to people would really this is something I really want to do, because I am a very social person and I love having interaction. Being a pharmacist also enables you to have the opportunity to open your own pharmacy, and being successful financially is something I always wanted to do. So strengthening my choice. So to establish for myself that pharmacy was what I wanted to study in university, I did a lot of research into pharmacy itself and looked at what it entailed and also what it can lead to. Most people, when they think of pharmacy, they only think of community pharmacy, but when you really look into it, it's very diverse, and there's so many different aspects that you can look into, such as industry is a big one that not many people know about, that is actually such a big option there to go into. I also did placement in secondary school in a community pharmacy where I was quickly swept into the world of drugs and patient care interactions. My uncle was also a pharmacist, so many conversations and discussions with him made my choice to study pharmacy strengthen. So I would definitely recommend that before you definitely pick pharmacy as your top choice, try and definitely go out on a placement into a pharmacy setting, either in the hospital or the community, or even just going into pharmacy and having like a quick conversation with a pharmacist. This would be like just very vital, just, you know, open your mind and just broaden it and just give you that like fact that, yeah, like this is what I want to do. So pharmacy school so far, pharmacy school has been really good so far. It's definitely had its ups and downs, especially since we started pharmacy in the year of COVID. So there was some stuff that we were very limited to. So what has gone well? Placements has gone well, especially in second year. In first year, we were limited to online placements. And in second year, we were able to go on physical placements, which was really enjoyable. The content we have covered has been really interesting and detailed. So in our uni and in the pharmacy school, they basically teach us integrated. And in first year, we basically covered childhood. In second year, we're doing adolescents now, so like young adults and teenagers, and then it kind of moves up. So we're kind of doing topics based on those stuff. So for example, because it's adolescents and young adults, we're doing STIs and some cancers such as cervical and testicular. So it's just been really like interesting and very detailed. So that's definitely something that's gone well this year. OSCEs, I think has gone really well. We have not done OSCEs yet in second year, as it's going to be later on in this year, but we did do OSCEs in first year, in the second semester. It's just something that basically takes everything you have learned in that year and puts it into practice, and just this is where you actually get to use like the skills you've gained, such as your communication, leadership, and all like your clinical. It's just very clinical and patient based. So it just gives you, I think it's one of the best things that just gives you a taste into what pharmacy really is. Link Up has gone really well. So we basically, as Jidel said, we have some GPHC standards. So we basically get a standard each semester, and we have to do so maybe activities or group projects, and basically have to do like an explanation and evidence them. This is just to get us ready for when you actually do it in training year and pre-reg year, because you will have like 40 or 50 standards to meet and you'll have to evidence. So they're basically starting us from the start, just getting into the pattern of doing these standards and evidencing them. So what hasn't gone well? Missing out on face-to-face interaction and classes. So first year, we were limited to mostly online classes, and half of second year. We only started face-to-face classes completely last week, Monday, which is kind of shocking, because I know other unis around the UK have gone back to face-to-face, but our uni kind of delayed on that. But it has been good because obviously it's different being in person and being in your room on the computer doing classes. So what hasn't gone well too is the big jump from first to second year. I don't think anybody actually really prepares you from the jump, because I think first year is just quite calm, like they're just kind of bringing you into everything. But once you get into second year, they're just kind of throwing everything at you, and like you just kind of have to pick yourself up and just manage your time well. I think that's a very big factor. So yeah. So placement so far. So like I said, we were only limited to online first year, but we were able to go actually in the first half of second year, we were able to go on physical placements. So since we started the course right in the middle of COVID, we were only limited to online placements where we did interactive activities and learning sessions with pharmacists in the hospital and community pharmacy. We also had a few sessions with some doctors in GP practices, which was really good, as this is a new setting that pharmacists are starting to get into, GP practices. So it's really good it was really good for us to be able to go on that too. Fortunately, due to easing of restrictions, we were able to go on placement in second year, and we were sent to the hospital, community, and the GP. That's a picture of me in the hospital. So these placements were very good, as we were able to put a good hands-on approach and also put our learning to good use, doing things such as a meds reconciliation. So this is basically where you go through medicines with someone. So they allowed us to do a meds rec with a patient in the hospital, just go through with them, ask them what medications they have with them, do they know how to use it, are they happy on it, what side effects are they experiencing, just stuff like that. Just kind of just a conversation just to see like if everything's good. We also shadowed some consultations in the community placement and in the GP. And in the pharmacy, in the community pharmacy, we also did some dispensing prescriptions, and just had some conversations with the pharmacist, and just learned how to use all like different softwares for dispensing the, doing the labels. So assignments we had were very tailored to the content we covered in each semester. Each assignment holds a certain amount of percentage weight that will add to the final mark of the semester. With the main exam, we're at 50% of the entire semester, and we are being examined on everything covered in that semester. Some examples of assignments we do are care plan, problem-based learning. So this is basically, the problem-based learning is basically, we are given a scenario each semester with a group that we're stuck with till fourth year. So big advice, if you have a group, just get along with everybody and make sure everyone knows their place. So we have this, and we do it every semester. So last semester, the main topic we did was asthma. So we were given a scenario on asthma, and we had to do up a PowerPoint presentation on it. Health promotion is basically promoting health. So if you look to the top right, where I have a poster on asthma, we basically had to do a poster on promoting what different healthcare people do in treating patients with asthma. So this is one of our assignments. So if you are very creative, I think this is something that will tailor to you. I'm not very creative, so I did struggle a bit with this assignment. We also have evidence-based medicine. This is stuff like looking at articles and research papers and answering questions. It's really good, as you will be doing a lot of research, especially in your dissertation. So this kind of just gets you ready and looking at data and stuff like that. So we also have LinkUp, which was the professional portfolio that Julia L discussed in her presentation. We also have calculations, 100% pass in first and second year. It's basically pharmaceutical calculations. There's 10 questions. You have to pass all 10 to get onto the next year. So it is quite challenging, but as long as you study and you practice and do it well ahead of time, you will be fine. OSCEs, like Judah L said, and I also mentioned in previous slides, you do this in the second semester of the year, and it's very clinical based. Basically, everything you kind of learned, there's 5 stations. You have you do a meds information, do a history taken. I think it's consultation, like a diagnosis, and you also maybe sometimes it could be like counseling people on weight loss or like stop smoking and stuff like that. We also have interprofessional education, also known as IPE. This is where we have classes with other healthcare professionals in our universities, such as nurses, biomed students, medicine students, and physio students. So it's just, we just have, we just get to have like a conversation with them and just kind of learn how to work in groups, because at the end of the day, when we do qualify, we will be working with them on a professional level in like the hospital setting, for example. So for us, getting an insight on what they do now would really benefit us now. So the modules we do are all integrated into one each semester. So in 1 year, we only have 2 modules because everything is integrated. And if you look on the right, I have uploaded a picture of how our modules is done. So they basically do it on how medicines work, which is chemistry, pharmaceutics, and physiology. How medicines work is just chemistry and pharmaceutics. How patients work is physiology, microbiology, and pharmacology. How pharmacists work, we have health policy, pharmacy practice, placement into professional education, health promotion and calculations. Then we have integrated therapeutics and decision making, which is basically just a mixture of stuff that is all integrated together. So some universities have loads of modules, but ours is just very integrated. Just so, because at the end of the day, everything is integrated. So it's better for them to start everything now than for us to do it later. So yeah. So advice that I could give is I would say have a timetable filled with when you have your classes, when your assignments are due. And if you do get a job, fill in the times you are working. Just having good time management is very, very important, as the course is very busy. Like, you will be doing something all the time. So having a good planner of your time will make life easier for you. Make notes on the lectures as soon as possible, and preferably have them done before class. This is a big thing. Always have your notes done before the class, because you don't want to be typing them up while the lecturer is talking, as you will miss what he's saying. As they do go quite fast, they skip through the notes. So having them in front of you and then either adding a few bits of what you hear, like of any important things you hear them say, will be very beneficial. Make a good group of friends in your pharmacy course. This is very essential for maybe when you're doing assignments or when you're studying. It's just very good to have people in your course so you can help each other and learn from each other. Always ask for help when you need it. Always, always. If you're stuck with anything, always reach out to your personal tutor. This may be assigned to you in your university, and even ask for help from your friends or lecturers when you need them. And have a good balance between social life, your uni life, and balancing work in there too. Just have a good balance and make sure everything is balanced. So always have a good social life too. Don't let uni overtake everything. Like, I think, like, you are being sent to uni, but always have a good balance of social life. Like, go out, have fun. In first year, have your fun, but also be very uni focused, and balance work in there too. So if you do have a job, just make sure everything is balanced too. Make time for yourself to just breathe. Things will get hard and overwhelming, so just breathe. Even if it's just having a day where you just stay in your room and just chill, or going to the gym or going for a walk, just have time for yourself, or like meditate or do anything that just makes you happy, and just breathe. And start your assignments as soon as possible. Leaving them last minute is not good, and you will stress. If your assignment is due even in the next month, I would advise you to start them as soon as possible, as I have seen people, I have witnessed people rush to them last minute, and it's not worth your time. Get your assignments done, out of the way. So thank you for listening, and if you have any questions, we will answer them at the end. So thank you.
Thank you, Oyin, for that. That was really, really good. I hope you're all, paying attention, writing down notes if you need to as well. If you have any comments, do put them in the chat. Next, we have Gloria to share her presentation. Oyin, if you want to stop sharing as well, please. Gloria, whenever you're ready, you can share your screen.
Yeah. Okay, is it working and everything?
Yeah, it's working.
All right. So yeah, welcome to my presentation. My name is Gloria George, and I'm also a pharmacy student. It's a pleasure to be here. So I'm just gonna obviously explain my journey into pharmacy school. So how it started is obviously after GCSEs, I went to college and I studied a course called BTech Applied Science Level 3, and I studied this course for 2 years. And I'm happy went well and everything, and I was able to finish off the course with 3 distinction stars. So the course really included like lab work, like placements, and also chemistry and biology, and also some modules also included physics as well. So I really enjoyed the course, and I really liked it because it really opened doors for new opportunities as well, and it opened doors for different careers within the medical field. So placement during college, obviously, I had my placement in the GP and in community pharmacy. So GP1 was in like year 12 and year 13 was in the community pharmacy. So I really enjoyed my community pharmacy one more, and that really it really solidified my choices in whether I wanted to study pharmacy or not. So after this placement, I was like, yeah,
I really wanted to study pharmacy. So I really engaged more with patients and undertook daily tasks such as unloading stock and interacting with patients and giving them legal advice as well under supervision of a pharmacist. So I was responsible for also packaging and dispensing as well. So it was a great experience and I really enjoyed it. So why I chose pharmacy. So work experience in year 10 was really it was really the first time I actually worked in a pharmacy. And it wasn't planned as well. It was really a teacher that actually got me this role. Because it was a pharmacy that she was always going to, that she was registered with. And it wasn't planned at all, but I really, really enjoyed it. And honestly, I really thank her for that, because her doing that has really made me the person I am today and studying this course. So placement, of course, as I said previously, during college, that really fueled my passion for pharmacy. And obviously, I was able to do more research in pharmacy before even choosing this degree. So I looked at like career opportunities after this course and how 90% of students are able to get a job even after graduating within 6 months, which is just great. And it's great to know that I'm able to gain clinical knowledge and gain patient-centered responsibilities as well. So first year in pharmacy in University of Lincoln, I would say it was quite a big jump from, school into uni. It did take some time to get used to, especially in first semester of first year. But I was really introduced to to all these modules and everything. So what we looked at early years. So we looked at like babies and children, and we looked at diseases that are very common in children. So this is like atopic eczema, infectious disease such as conjunctivitis. We even looked at vaccinations as well, and cancers and pregnancy, breastfeeding and drugs, blood anemia. And I really enjoyed learning those topics as well and then applying it in the clinical setting. My social life during that time was obviously, I was still meeting new people and building my social network of friends as well. So I was still getting used to the environment of, being in uni and organizing myself as well. So placement during first year was really online. So I wasn't able to really get the full experience of, being on placement face to face, having that patient, that interaction as well. So with our online placement, we really just looked at drug charts and how to fill them in, like what they are. We spoke about we spoke to pre-registration pharmacists and asked them questions. And online placement community, we just looked at how to take in prescriptions, also counseling and diagnosis as well. So and how to give legal advice with the prescriptions for patients. Online placement in the GP, we just spoke with the GP and asked them questions and looked at different scenarios and discussed it as well. So it was engaging, it was great as well, but I felt like it still wasn't the same. But overall, due to COVID-19, everything that was going on at that time, it still went well. So moving on to second year pharmacy school. Of course, as you can see, we have a lot more modules and the content is a lot this year, but we're still right now going through it. So we're really just looking at immunological and inflammatory diseases. So we're really looking at asthma. So recently we just finished doing first semester, and now we're now in second semester. So we were really focused on asthma and STDs and looking at cancers as well, like testicular cancer and cervical cancers, and also degenerative and genetic diseases such as cystic fibrosis. So I really enjoyed looking at these stuff, as we're able to apply that during patient care as well, and look into different medications used to treat these diseases. And my social life, I would say in second year would be, I've already found my network of friends. I'm still also getting to know more people as well. But I found my network of friends, especially within my course. So we're able to, of course, help each other. And yeah. So placement in second year so far is obviously face to face. So as they were able to ease off the restrictions now, people are able to meet face to face and to actually interact with patients. So with the hospital one, I would say it went well, but we mostly filled out drug charts and looked at different boards interacting with patients. But I would say it went very well. And of course, it depends on the individual. Some people may actually enjoy hospital placement. And there wasn't much we really had to do that day, but it was still good. It was still a great experience. With community pharmacy, I would say I enjoyed the most. I really got to work with a pre-registration student, and he helped me complete tasks set for me by the School of Pharmacy that day. And I was able to give medical advice on how to take inhalers, and also antibiotics as well. So I was given like different prescriptions to actually interact with patients and give them legal advice. So the pharmacist would always like help me and challenge me to actually give that advice as well. So it went very well that day actually. And then with GP placement, all I had to do was really just to complete a booklet and to shadow the GP and the pharmacists as well working in the surgery. It was good, but it didn't really go so well that day. But it still went well overall. I still learned a lot that day, especially in filling in the prescriptions as well online. So our assessments and assignments that we've had so far. So the main ones we've had so far, especially this year, would be IPE, as known as interprofessional education. So in second semester, we normally do an essay, and in first semester, we have an infographic. And then we also have LinkUp and a 50% main examination. And we also have pharmaceutical calculations, problem-based learning, and health promotion. There's obviously way more assignments and assessments like this as well, but these are the main important assignments that we have. So with our 50% main examination, that really just includes all the content that we learned in each semester. So we have this examination twice a year, basically. So we have it in first semester and second semester, and everything that we've learned is basically integrated and is put into one exam. So a way that we revise would be basically to look at how the pharmacist works, how the patient works, looking at different topics that we've learned about, what is that pharmacokinetics, like pharmacology, just various topics that we've been taught during our lectures. So with calculations, we have to get 100% in our exam, as recently mentioned before. So with this exam, it's quite easy, but then it's quite a lot of pressure as well, because you have to get like a full mark and you have to pass out the entire exam. Every single question has to be correct and accurate as well. So with that, I'd recommend to just practice and to keep on going through it and going through it with your peers as well. So I like the fact that the assessments and assignments that we have this year, the assessments and assignments we've had this year are very integrated and having to do with our course so well. So I was able to really gain knowledge in all our assignments and everything that we do. And even with the topics that we learned this year, I was able to also do further research on it and apply it in a clinical setting to advise patients. So my advice, I'd say, is to plan weekly and to set goals for yourself as well, and to take breaks and attend more social events. Social events could be like societies within your uni, and to make notes as soon as the lecture notes are released. And it's very important as well to start your assignments early. It's not good to start them very late. And to think carefully and confidently in every decision that you make. And it's very important as well to attend all your lectures and to review the materials. And especially during revision, not to revise, not to go through the materials very late, especially near to the exam, because everything is not all going to enter, it's not all going to sink in. So it's good to just go through it just take one step at a time. And also, and it's very important, of course, to make friends within your course and to work together in completing your assignments, even when you're doing your exams as well. And to ask your lecturers for help, to really utilize your lecturers. Email them whenever you can, whether it's an assignment or any assessment, and look for study guides and books on different topics in pharmacy. So one that I'm using now is looking at the drugs, at the top 100 drugs. And this book was actually recommended by a friend of mine that's in 4th year. And this book helped me get through first year very well. So and I really just followed these steps myself, and it helped me really get through even first semester of this year as well. It has been quite difficult, but I've been able to really get through it, and you can as well. Just to be organized and just to make sure that everything is planned well. And yeah. So thank you for listening. Any questions?
Thank you, Gloria, for sharing. That was awesome. So we've come to the end of our workshop, everyone. So if this is the time for questions, so we're going to take any questions that anyone has, whether it's targeted specifically to Gloria or Oyinkan or myself. You can let us know whatever questions you have. Someone's asked, who is the author for the book? Okay, Oyinkan has answered it.
How do I stop sharing?
There should be something at the top that says stop sharing. Can you see it?
Okay, got it.
Awesome. Okay, I think I've got some questions. What is the book called? Someone said. Gloria?
Book is called The Top 100 Drugs.
Do you want to type it in the chat?
Yeah, well, you can find it on Amazon.
Mm-hmm.
Okay, someone said current. Okay, so someone said that they're a current first year student and they're asking for advice for care plans as they're starting this semester. Do you have any advice? And also, do you have any advice for the exams? Do any of you guys want to answer that?
For the care plans, what I would say is do not leave any blanks. Our lecturers have pushed us on this. So what I would say is read like the little scenario they give you, highlight all the key facts and fill in everything that you can. Just do not leave any blanks. Even if it's stuff like age, put in everything. And for the what's the thing at the end where you have to write like a very detailed part? Do you guys remember what that's called?
Drug therapy problems.
Drug therapy problems. You need to make sure that those are really structured well, and you put them from whichever one's the most important to the next. I'm not gonna say the least important, but like the one that doesn't need to be sorted out right away, if that makes sense. But just try detailed as much as possible and do like full sentences. Don't just keep like bullet points. Just make them very detailed if you can.
I think the second part of her question was, do you have any advice for the exams? In terms of that question, that's a really good question. I would say definitely start revision very early. It's quite hard to figure out how you revise, but if you've got a system already, I think it's really important to get a system of revision, like knowing how, like what works best for you. So once you've got that system, make sure you start early. And the thing is, with lecture slides, they're really good, but sometimes they actually require that you do further research. So when you're doing your revision on your lecture slides, pick out what you think is the important information, or even go far as to email your lecturers and be like, oh, could you highlight your presentation so that we can know, what is the most important information? Because usually most of the time, not everything comes up. That's just how it works. But yeah, I would say start early, make sure you know the key information. So what I do personally with my lecture slides, I will read my lecture slide and I'll make questions out of my lecture slides. And then I keep testing myself using flashcards, using study groups. So as they mentioned before, make like finding friends or people in your course that you can, study with. That really, really helps because you can kind of bounce off of each other. I hope that helped.
There was another question there, Judel, if you want to answer. A girl asked, what advice would you give to future pharmacy students?
Good question. I guess I would say you would need, just remember why exactly you want to study pharmacy. We're not trying to put you off or anything like that, but I think before just starting, make sure you know why you're starting, because it requires a lot of determination and resilience as well, because, you know, it does get quite hefty and it does get quite overwhelming as the years go by. But just having that thing in the back of your head, you're like, okay, I know why I want to study pharmacy. I know my end goal. It will kind of give you that drive. I think surrounding yourself with the, you know, like-minded people, being intentional in, you know, building friendships as well. You know, you want to balance your university life. You don't just want to be solely in your books. You need to have a balanced life. But I would say, yeah, definitely remember why you started. Ask for help whenever you can. There's nothing too small. Like, always like email your lecturers as much as you can. You know, that's what they're there for. Always start revision early. Always do your assignments early as well, and just make the most of it. Have fun. It is a really, really good degree, and yeah, it'll take you places as well.
There's another question there. I have no friends in uni. What advice would you give to finding a good study group? Do you want to answer that, or should we pass it to
one of you guys? Want to answer that?
Gloria? She hasn't answered anything, so you can pass it on to her.
Yeah, I would say that to go into more like social events as well. So any societies within your uni, and even your own society, like here in Lincoln, we have a pharmacy society. So attending that as well, and getting to know more people, you know, just being confident, then, you know, you can be able to find like a good study group.
Awesome. Guys, have any more questions before we round up? I think we've got about 4 minutes left. Everyone I've spoken to keeps talking about the jump from first to second. Should I be scared? Do you know what it is? I feel like first year, it grounds you. Like it kind of, it prepares you just a little bit for second year. But it is a big jump. Like we can't deny the fact it is a big jump. I don't think you should be scared, because if you really used your first year well and you were able to understand how your course works, you were able to, you know, have a revision system, you were able to, you know, find that study group, you were able to know how how you revise and manage your time. When you get into second year, I think the only difference is not the fact that the content is harder, but it's just like it gets busier. So you just need to have better time management.
I feel like second year kind of really humbles you. Like you kind of just need to I feel like you just kind of need to, what's the word? Like you need to push yourself. Like the way you were in first year, you need to just kick it up a notch. Do you get me? But don't be scared. Like you will be fine. Like we are fine, hopefully. But just give yourself that push and you will honestly be fine. Don't worry.
Yeah. Someone has said, what about the degree do you like and dislike the most? Gloria and Oyinkan, would you like to answer that? Anyone of you can go first.
I really like the OSCEs and like the link app, because they are really stuff that we will be doing in pre-reg. So it's kind of good to start this now. So when we do get to pre-reg, it will be easy for us to, and the calculation, even though it's not really a likable thing, it is something we will be doing in pre-reg. So at least it's getting us ready for that. It's just testing us now and just getting us really equipped for that.
Yeah. Gloria.
I would say for me, I don't really like our health promotion that we did this year. Well, but I think now doing it, like executing it and talking to the public, I did enjoy it. But I'll say what I really like this year, what I really like in this degree would be, yeah, I'd say also our OSCEs. I think preparing for it as well, looking at the different diseases and conditions and medications to treat it is very interesting. So, because I really enjoyed that patient interaction. So, yeah.
How much time do you spend in the lab? Not a lot, actually. We rarely have labs. It was, for us, it's really been like once in a blue moon, I can't lie. Like every semester, probably we just have like one in each semester. So we don't have that many at all. But when we do have it, the sessions usually last about 3 hours, 2 to 3 hours for one session. Yeah, it's not consistent at all. How hard would you say the degree is? I think it really depends. It really, really depends on you. I think overall it is an intense degree. Like one word for it would probably be intense. But it's possible. Like you can do it. Is manageable. That's the word I'd say. Yeah, you really just have to pace yourself and really want to do this.
Yeah, it's
Intense.
a very like demanding degree.
Yeah, that's the word. When I say intense, I guess I'm referring to just how overwhelming assignments, exams can be. So, like right now, our lectures on Monday and Tuesdays is like a 10 a.m. to a 5 p.m., like a full day full of lectures. And then obviously on top of that, we have assignments. So that's what I mean when I say intense. So there's a lot to do, like you're always busy. How would you recommend getting over a burnout or being stressed? That's a really, really good question. Would any of you guys want to answer that?
I would say like just taking a breather, like as what Yinkan like mentioned before, whether it's to just take some time to yourself, whether it's to be with friends or family, just to take a break from like uni and everything that's going on. And yeah.
Yeah. Do you have time for a social life? I feel like with the social life, it kind of gets established in year one. Like first year is kind of when you establish your friends and all of that. So like once you have your friends, going into second year wouldn't be a problem because you already made that in first year, if that makes sense.
Yeah, I think you do have a time for social life because I did anyways. And I definitely balanced everything. Like I did have loads of fun, especially second year because obviously COVID restrictions were lifted. I think you definitely, if you balance your time well, but obviously make sure you prioritize uni, obviously, you will have time to enjoy yourself and have a good social life for sure. Because at the end of the day, it is uni, like you are there to have fun and get your degree. So yeah, I think you definitely, everyone has time for that.
Yeah. Yeah, you will
I
be
just
able
saw,
to.
sorry, I just saw the question. I live so far from home. I hope I'll be okay. I understand how you feel. I live quite far, not quite far, like it's a plane and a train ride, but you will be fine. Once you have friends, once you make friends, which you will be fine. Because that does definitely ease the stress of like missing family at home. So yeah, and always stay in contact with family, like phone calls, even if it's every day, like you'll be fine, don't worry.
Yeah. In terms of the timetable, it tends to be okay, so you have Monday and Tuesday just like we do, yeah. So it tends to be consistent. So second year you'll probably have about the same. If anything, they might add like an extra day or something. Yeah, so like right now we have Mondays and Tuesdays, and then we have like an odd Wednesday, Thursday kind of lecture. But yeah, it tends to be the same. It tends to be the same. You guys ever have any more questions before we round up? I know we've just gone past our time a little
I
bit.
just saw something there. We should meet up sometime when we have so much in common. Drop me a message. We can plan a meetup. Alright.
Okay, there's no more questions. We'll round up. Thank you all for joining today. This is our second event with Meant to Be Consultants, and it's been really, really, fun being able to pour out and speak to you guys. I hope you guys have found this useful. How have you guys found this session? Did you find it useful? Did you learn something? Let me know in the comments. I'd love to know how you guys have found it. We do have a third event on Monday, which is about careers in pharmacy. So I'm going to be going through the careers, the different sectors in pharmacy, because I feel like a lot of people just think it's the local pharmacy, that's the only pharmacist that I see. But really and truly, there's a lot more that you can go into. So if you join our session on, Monday, follow Meant to Be Consultants on Instagram. The link is in their bio to register for that event. Med2B consultants also have pharmacy services. So if you go on their website, which is Med2B, I'm going to type it in, Med2B consultants. Let me get it right. Chitsa, if you can type it in there for me, that'd be great. If you go on their website, we have pharmacy services whereby I can help you with your personal statements, interviews, all that kind of stuff. So yeah, have a look on there and you'll find some really good services that you can get involved in. But yeah, thank you so much, everyone. And I hope you're successful in your journey and that you've gained loads of information from the students here today. But yeah, on that note, everyone have a lovely evening and I will see you soon. Bye, everyone.
Thank you. Bye-bye.
Thank you. Bye.